Hello, this is a short overview introduction to our automated normal pathology check file and SMS platform. It's one of our MyBotGP range products. Not all normal results are normal for the patient. All of our kit lives in NHS Cloud. Super important because it means that data sharing agreements, DTACs are all very straightforward. This particular tool is classed as a medical device and has a DCBO 129 certification. We're in hundreds of practices across the UK, and all of our kit can be bespoke at practice level. Why that's important, as different practices will have different opinions on how to validate pathology tests, and you can do that yourself. There is no restriction on bespoking. Principle behind our tool obviously is to reduce practice cost, improve patient safety, and help you do more with less by leveraging automation tools. Very, very quickly, as this is a short intro, business case, 8,500 list has approximately 5 partners. They are currently processing just under 62,500 pathology tests every year. That's 200 a day. So yes, that's correct. An 8,500 list is processing 62,400 pathology tests every single day. All of those tests will be being screened manually by the clinicians at the moment, and every single test and every clinician will be spending up to 30 minutes per day on this task. All path tests sit in 3 buckets: normal, no action; normal but may need action, i.e. check the patient history or pathology test report, as of course the lab is just making an evaluational comment on the path test. They are not taking into consideration patient history. And abnormal. So these 62,400 pathology tests a year sit in 3 buckets: normal, no action; normal but may need action, i.e. check patient history, medication, health conditions, percentage increase, decrease; or abnormal, where the way that MyBotGP works is, think of it as a massive security blanket on the front of your practice where all pathology tests are vetted for safety and time saving. All of the normals that do not need further investigation will be filed by itself, and you can send text messages if you wish. And all of the normal results that come from the pathology test report, where you would need to do further investigatory work on the patient to determine whether that pathology test is actually normal for the patient, will be done by MyBotGP. If MyBotGP sees a health condition or medication or percentage increase or decrease, it will not file that and it will flag it for further investigation. If it passes, i.e. there are no warnings against that patient, and that normal will also be filed and classed as normal. Massive cost and time saving to your practice. Current statistics are every GP is spending up to 30 minutes a day on this task alone. In addition to that, MyBotGP will ensure additional checks are done on all pathology tests without mistake, so there's improved safety. All path tests will pass through that, so additional checks will be run on everything without fail. Standardization and cover for holidays, and obviously help support clinical fatigue. Current cost and time saving is astronomical. Across an 8,500 list with 5 partners, you can actually recoup 95 days of clinical time at an approximate clinical cost of £50,000 a year. Very quickly, our rules are here. You can use any combination of these rules to validate pathology test results and what they mean for a patient, then file or flag. Currently, we're running 200 different pathology tests through this platform, and it works 7 days a week, 365 days a year. So, do you agree with the lab? Would you like to supersede the lab? Would you like MyBotGP to pick up a pathology test report and check a previous path test to look for a percentage increase or decrease? MyBotGP can read the patient history, look for health conditions or medication to determine whether that normal needs further investigation. It can also read the path report as well to check for warnings. It can also read results for path tests that do not have ranges, so it can look for words: detected, not detected, positive, negative, and so on and so forth. Obviously, you can separate in terms of age and gender. You can omit patients, and you can send SMSs where appropriate. So a quick example scenario is prostate. Lots of our clients supersede lab ranges for prostate, as most labs give 1 range. What they tend to do is to add 5 ages and 5 ranges. In addition to that, they ask MyBotGP to check into the patient record to see if the patient has had cancer, prostate cancer or metastatic cancer, and even if it passes superseded lab range for the 5 ages and 5 ranges, they tell it to fail because they want to see that test. Another example is HbA1c. Does it say diabetes or pre-diabetes? Obviously, we've seen multiple iterations of how practices across the countries are making assessments on some renal tests, increases, decreases, looking for medication, and so on and so forth. This tool is managing 200 different pathology tests across the country. I'm going to just show you a quick snapshot. Here is 181 different pathology tests and some of the logic that our clients are using MyBotGP to filter against to determine whether these can be filed or not filed or sent for further investigation. Obviously, we can go into more detail. This is just a quick snapshot so you can see through here. Everything is delivered from NHS Cloud as well, so super robust. Thank you very much.